First of all, your number is 139.
Wow.
Yeah.
Well, I just got finished smoking, so.
Oh, that'll do it too.
Dr. Harold Katz is using a device called the Halimeter to determine whether this person has bad breath, and the verdict stinks.
Ooh.
109. What'd you eat?
I had some Italian food, garlic and
Yeah,
stuff.
garlic and onions will do it.
A normal reaction, according to the doctor, who has been researching halitosis since 1994. This contraption he's using is called a Halimeter.
The Halimeter is a clinical instrument which measures the concentration of volatile sulfur compounds in your breath, and it gives us a reading to determine if someone has bad breath or not. We know now that at 70 parts per billion, that's the level at which people start to detect that as an odor. Once it gets to 120, that could be a case of chronic bad breath, where people may have associated dry mouth and sour, bitter tastes along with that.
Katz says his research shows that halitosis can affect a person's entire life, making them withdrawn and paranoid. And you'd be surprised at what the doctor says creates bad breath.
95% of all cases of bad breath are caused by what are called anaerobic sulfur-producing bacteria. They live beneath the surface of the tongue and often in the throat and tonsil area.
In addition to the usual culprits, spicy foods, onions and garlic, antibiotics and other medications, and even some mouthwashes and toothpastes cause it because they contain alcohol or harsh detergents.
There are several misconceptions about bad breath, the worst of which that it comes from your stomach. Bad breath does not come from your stomach. There are muscles which line your esophagus that prevent that from happening.
The good news is there are ways to rid yourself of offensive breath. The key is a substance called oxidate, which eliminates the sulfur compounds that cause halitosis, instead of trying to hide them with mouthwashes or candy mints. How do you learn more? Hit the net and click on, you guessed it, freshbreath.com.
Most people treat bad breath as something quite comical, and actually it could be quite serious. Symptoms of bad breath can be related to blood diseases, lung disease, kidney disease, liver disease, and the bacteria which cause bad breath are also related to an increase in heart attacks, strokes, even premature low birth weight babies and pregnant women. Statistically speaking, about 80 million Americans have bad breath. That's about a third of the population. And we see that holds true all around the world. Nobody wants to have bad breath, and we've received almost as many emails from places like Sri Lanka and Kazakhstan as from Iowa and Nebraska. Well, first of all, I'm a dentist. I got my degree, my DDS degree from UCLA in 1975. Before that, I got a degree in bacteriology, and because bacteria are the root cause of bad breath, I was already sort of ahead of the others in the field. But in 1993, my own daughter had a problem with bad breath. That's what led me to research the field of bad breath, and since that time I've sponsored 3 international conferences on bad breath in Vancouver, at UCLA, and last one was in Japan. Next year will be another conference I'm sponsoring in London. We founded the first group of international breath clinics called the California Breath Clinics back in 1994 for the purpose of helping people find out what the cause of bad breath is and actually how to get rid of it. Yeah, in honor of National Fresh Breath Day, throughout all of August, we're giving away free things through the website freshbreath.com, things like free tongue cleaners and various TheraBreath products. Our website, freshbreath.com, has several things: tips on how to keep your breath fresh 24 hours a day, a free online breath test. Let's say your boss has bad breath and you can't tell them, we'll do it for you through the website. And also referrals to doctors around the country that specialize in treating bad breath. Well, oxidate is an oxygenating compound. The version that we use is a patented formula, technically called stabilized chlorine dioxide. And what it does, it releases an oxygen molecule which attaches to the bacteria and to the sulfur compounds, basically destroying all the odors and sour, bitter tastes. Therefore, you have fresh breath, fresh, clean taste throughout the day.
I use mouthwash and I use breath mints.
Okay. Brush my teeth and chew gum.
I try to brush my teeth after every meal, and I chew gum.
Keep your breath nice and clean. Trainer.
Brush them twice a day and rinse your mouthwash.
Okay.
Actually, I use Orbit gum. Yeah, it's got like the crest whitening in it or something.
Right.
Chew parsley when I can carry it around.
Okay, keep your mouth wide open. That's good. Oh, I did okay. We hit about 91 there. Is your mouth getting a little dry today?
My mouth is dry.
It is dry, yeah, because whenever someone has a dry mouth, the bacteria react to the dryness and create sulfur compounds. So,
Yes.
got to make sure you drink plenty of water during the day. That'll help. traditional mouthwashes and toothpaste, you have to be careful. They contain alcohol and other detergents. So look for something that has an ingredient called oxidate. It's an oxygenating compound that stops bad breath.
Yes.
You get a bit higher. You get up to 82. You got to make sure if you have a pierced tongue, you got to keep your tongue really clean because you can trap bacteria underneath there. And those bacteria can cause bad breath. Okay, I'll just stick your tongue out as far as you can and hold your breath. Okay, a little farther. Okay.